Do you know how new ways of treating a bigger prostate can lower the risk of getting prostate cancer? Many people may be familiar with the issue because BPH is one of the most common problems men have with their prostates, especially as they get older. Dr. John Smith, a famous urologist, says that prostate enlargement affects more than just your urinary system. It affects your whole quality of life. In this video, we will discuss the power to make decisions about BPH, no matter what age you are. We're here to help you learn about this common condition, how to diagnose it, and the different ways it can be treated. By the end of this video, you'll have learned useful things that will help you or a loved one make smart choices about how to treat and manage a swollen prostate. Understanding of prostate enlarged. Let's figure out what benign prostatic hyperplasia, BPH, which is medically short for growth of the prostate, means. This disease is a growth of the prostate gland that can be painful and could lead to health problems. The prostate gland is a small but powerful structure that is very important for both your reproductive and urinary systems. Imagine it getting bigger and pushing on your bladder and urethra. A lot of unpleasant symptoms can be caused by this growth. Age is the most important factor. Your chance of BPH rises with age. As people get older, they often feel this way, but there's more to what happens. Your family background may also give you hints about how likely you are to get BPH. If your dad or brother has had problems with their prostate, you may be more likely to too. The way you live has a big impact on the health of your prostate. A diet high in fats, not getting enough exercise, and being overweight are all things that can lead to BPH. Your age, your genes, and the way you live all have an effect on your prostate health, like the pieces of a puzzle. If you want to know in complete detail about the symptoms of an enlarged prostate, then you should watch our video on this topic. Before knowing about the enlarged treatment options, it is necessary to know what type of signs your body feels. So it's important to recognize the enlarged prostate. There are many methods of detecting this disease. The standard methods for diagnosing prostate enlargement. It's important to recognize prostate enlargement early, and knowing when and how to be assessed can make a big difference in your overall health. Let us go over the steps needed to diagnose BPH. The most important thing is to know when to see a doctor. If you're having problems like nocturia, urinating at night, regular urination, or having trouble starting or keeping a stream going, you should talk to your doctor. Checkups are very important, especially if you're over 50 or have a history of prostate problems in your family. If you detect BPH early, you can better take care of it. Let's talk about the medical tests now. Number 3. Prostate-Specific Antigen, PSA. A popular place to start is with the Prostate-Specific Antigen, PSA, blood test. It checks how much PSA is in your blood. Higher amounts may mean that your prostate is getting bigger or that you have another health problem. Number 2. Digital rectal exam. One more common test is the digital rectal exam, DRE. Your doctor will feel your prostate to see how big and round it is during this test. It may be painful, but it's a quick and important way to check the health of your prostate. Number 1. Ultrasound. In addition, a scan may be done. This test gives doctors a picture of the prostate, which helps them figure out how big it is and look for any problems. Remember that being in charge of your health means staying aware and reacting before problems happen. If you notice any changes or signs, don't wait to see a doctor. Your health is in your own hands, and finding prostate growth early is a very important part of staying healthy. Enlarged prostate treatments, bad prostate health, or BPH, can be treated in a number of ways. There are many ways to get better and deal with your problems. You just need to find the one that works best for you. Let's take a look at these paths. Number 8. Lifestyle modifications. First, make changes to your daily routine. This is your first line of defense. Small changes to what you eat can have a big effect. Urinary problems can be helped by drinking more water and cutting back on caffeine, booze, and spicy foods. Regular exercise, especially routines for the pelvic floor, can also help you control your bladder. You can think of these changes as making your body's engine run better. Number 7. Medicines. Alpha blockers, such as tamsulosin and alfuzosin, make the muscles in the bladder and prostate loosen up. This makes it easier for urine to move. Next, there are 5-alpha reductase inhibitors, which drop the size of the prostate. Finasteride and dutasteride are 2 examples. These medicines are like specialized tools that are made to ease the symptoms of BPH. Number 6. Surgery. Surgery is used when changing your habits and taking medicine aren't enough. Transurethral resection of the prostate is an old but effective way to clear the urine tract by cutting out parts of the prostate. Then there's laser therapy, which uses focused light to get rid of extra prostate cells and is less invasive. It's very precise, which means it helps you heal faster. Number 5. UroLift. UroLift is a newer, less invasive choice that lifts and holds the swollen prostate tissue out of the way, like clearing a blockage in a tunnel. This new treatment can make urine flow much better with little recovery time. Dr. Jane Doe, a well-known doctor, says, "Managing BPH can be easy with the right treatment, making life much better." This quote makes a point of showing how important individual treatment plans are. The goal is to get you back to comfort and health, whether that means making changes to your lifestyle, taking medicine, or having surgery. Remember that everything about your BPH journey is different, and there is a treatment plan that is just right for you. Do something about it. Talk to your doctor about your choices, and take the steps toward a better, symptom-free life. Number 4. Aquablation Therapy. Aquablation therapy is a new and different way to treat BPH. This procedure uses a high-speed water jet under real-time ultrasound imaging control to carefully remove prostate tissue. Unlike traditional surgery, aquablation therapy combines the accuracy of advanced imaging with the gentleness of water. This lowers the chance of side effects that are common after prostate surgery. This treatment is especially helpful for people who want to find a balance between getting rid of their symptoms effectively and maintaining their sexual function. Number 3. Prostatic artery embolization, an innovative non-surgical treatment for BPH called prostatic artery embolization, has made a big step forward in the field. A catheter is used in this minimally invasive treatment to inject tiny particles into the arteries of the prostate. This stops blood flow to the prostate and makes it smaller. This decrease in size helps with bladder problems without having to have surgery. Patients who may not have good options for surgery because of other health problems or who want an alternative with a shorter recovery time may benefit the most from PAE. Number 2. High-intensity focused ultrasound. HIFU is a new and effective way to treat BPH. It does this by using focused ultrasound waves to target and remove extra prostate tissue. One of the best things about this method is that it doesn't involve surgery and has few side effects. Because HIFU is so precise, it can treat specific areas, which lowers the risk of damaging nearby organs and keeps sexual function. It's the best choice for people who want to find a mix between getting good relief from their symptoms and maintaining their quality of life. Rezūm water vapor therapy. This is a new way to treat BPH that uses the natural energy stored in water vapor, or steam. Small amounts of steam are put straight into the prostate tissue as part of this minimally invasive procedure. The steam then turns back into water, which releases energy that kills the extra prostate cells. Rezūm is a good choice for people who want an effective alternative to traditional surgery because the process is quick. There are few side effects, and recovery is quick. Tips for managing enlarged prostate. Number 8. Limiting fluid intake. Limiting fluid intake, especially in the evening, can greatly reduce the need to go to the bathroom at night, which is a typical sign of BPH. This small change helps keep you from waking up during the night and makes your sleep generally better. Finding the right mix means staying hydrated and controlling how often you have to go to the bathroom. Number 7. Regular exercise routine. Regular exercise, especially pelvic floor movements, makes the muscles that control the bladder stronger. This may help the urinary system work better and ease discomfort. In addition to improving prostate health, exercise is good for your health in general. Number 6. Changing what you eat. A diet high in fruits, veggies, and whole grains, and low in alcohol and caffeine can help you control your BPH symptoms. These things are easier on the bladder, so you won't have to go to the bathroom as often or as quickly. Eating well not only helps the health of your prostate, but also your general health. Number 5. Taking into consideration your feelings. It's normal to feel stressed or ashamed when you have BPH symptoms. The first thing you need to do to deal with these thoughts is to recognize them. Realizing that a lot of other guys go through the same problems can help you feel less alone or embarrassed. Number 4. Building a support network. Talking about your experiences with family, friends, or men's health support groups can help you feel better and learn new things. Support groups like these give people a sense of community and understanding, which is very important for dealing with the mental effects of BPH. Number 3, getting professional help. Therapy or counseling can help you learn how to deal with the stress, worry, or depression that may come with BPH. Mental health professionals can help people learn how to control their emotions and deal with problems better, which is good for their general mental health. Number 2, relaxation techniques. Deep breathing, yoga, meditation, and other practices like these can help you feel less stressed and improve your mental health. Adding these techniques to your daily life can help you deal with the mental effects of having BPH, leaving you feeling more balanced and calm. Number 1, regular health checkups. It's important to stay in touch with your doctor in order to manage BPH. Checkups on a regular basis let doctors see how the symptoms are getting worse and make changes to the treatment plans as needed. This proactive method makes sure that both mental and physical health are taken care of properly. Using these tips can help you deal with prostate growth in a more comfortable and controlled way. It's about dealing with both the physical and emotional parts of BPH as a whole, and giving yourself the tools to live a good life despite having the disease. As we come to the end of our discussion on prostate growth, let's go over the most important points again. We have talked about what BPH is, its signs, and how important it is to find it early. We've looked at a wide range of methods that can be suited to each person's needs, from making changes to their lifestyle to medical interventions. Remember that the best way to take care of your prostate health is to be aware of it and act quickly. You can get personalized and effective treatment plans if you see your doctor regularly and talk to them openly. I want you to use these ideas in your own life, or share them with people you care about. The health of your prostate is a process that needs care and attention. So share and subscribe to informative videos for the betterment of your health.